Hello, welcome back to Off Grid Style. I'm Nikki, and today we're going to discuss basic first aid. This is something that every single person should know something about. We're going to cover all kinds of different things in this video, but this is something you can use every single day. This is not just a survival situation video. This is something that you just need to have some knowledge of just in case something happens. So let's get started on basic first aid. If you enjoy this video, please don't forget to like, subscribe, comment. It always helps us in the algorithm to get our videos out to more people. Thank you. First aid is a crucial set of skills that can save lives and reduce the severity of injuries in emergencies. In this video, we will focus on key aspects of rendering first aid, including controlling bleeding, immobilizing fractures, providing sprain care, assessing the scene, evaluating the victim, and monitoring vital signs. These skills are essential for trained professional caregivers to learn as they can be applied in various situations from accidents at home to outdoor adventures. Please note, this is not an official training video. This video is for information purposes only. You can look at different areas around your town to find who holds first aid courses that can get you certified. Because this is not an official training video, please keep in mind you will be performing these skills at your own risk. Before performing these skills, first obtain a basic first responder certificate, as I mentioned earlier. First, let's look at assessing the scene. Before approaching a victim, it is essential to ensure your safety. Ensure that the scene is safe for both you and the victim. Be cautious of potential hazards like traffic, fire, or unstable structures. If available, wear disposable gloves to protect against infection when dealing with bodily fluids. Assessing the victim. When approaching the victim, follow these steps. Check if the victim is conscious by tapping them gently and shouting, "Are you okay?" Be sure to check that the victim's airway is clear and unobstructed. If necessary, gently tilt their head back and lift their chin as you see depicted here. Check for signs of breathing. Look, listen, and feel for chest rise and fall. Only perform CPR if you have been certified to do so by an accredited institution. If there are no signs of breathing or you cannot feel a pulse, call for help immediately. Call 911 and get the person to the emergency room immediately. Monitoring vital signs. Monitoring vital signs helps assess the victim's overall condition. First, get the person's permission if able and take their blood pressure if trained to do so. Check the person's pulse by placing your fingers on their wrist or their neck. Count the beats for 15 seconds and multiply by 4 to get the heart rate. An adult's normal heart rate is 60 to 100 BPM or beats per minute. Observe the victim's chest rise and fall and count their breaths for 15 seconds. Then multiply by 4 to calculate the respiratory rate. A normal respiratory rate for an adult is 12 to 18 breaths per minute. Assess the victim's skin color and temperature. Pale, clammy skin can indicate shock. Controlling bleeding. Uncontrolled bleeding can be life-threatening. Here are the steps to effectively control bleeding. Determine the severity of the bleeding. Minor bleeding can often be controlled with pressure alone, while severe bleeding may require additional measures. Apply direct pressure to the wound using a clean cloth, sterile bandage, or your hand. Press firmly to help stop the bleeding. If possible, raise the bleeding limb above heart level. This can reduce blood flow to the injured area. Immobilizing fractures. Fractures require immobilization to prevent further injury. Let's look at how to immobilize a fracture. Assess for a fracture. Check for deformities, pain, swelling, and loss of function in the injured area. Also, ensure there is a pulse in the wounded limb. Stabilize the fracture by splinting it. You can use materials like boards, branches, rolled newspapers, clothing, or pillows to create a splint. Secure the splint above and below the fracture site using bandages, belts, or any available straps. Check to make sure that the splint is snug but not so tight it cuts off circulation. If possible, elevate the limb as this can help reduce swelling and alleviate pain. Providing sprain care. Fractures refer to broken bones. Sprains, on the other hand, involve stretching or tearing of ligaments and require proper care. Encourage the victim to rest the injured area to prevent further damage. Apply an ice pack wrapped in a cloth for 15 to 20 minutes every 1 to 2 hours during the first 24 to 48 hours to reduce swelling. Use an elastic bandage to compress the area gently to minimize swelling. Elevate the injured limb above the heart level to reduce swelling and promote healing. Mastering the basics of rendering first aid, including controlling bleeding, immobilizing fractures, providing sprain care, assessing the scene, evaluating the victim, and monitoring vital signs, empowers individuals to respond effectively in emergencies. These skills can make a significant difference in the outcome of injuries and contribute to the safety and well-being of those in need. Regular training and practice are key to maintaining readiness and competence in first aid skills. Please remember, this was for informational purposes only. This is not considered medical device or a substitute for actual training or obtaining a basic first responder certificate. I hope you enjoyed this video on first aid. Please let me know what you thought of it. If you have any other things that you would think about doing, say hello, comment, like, subscribe, all those good things, and I'll see you again soon.